Now let's proceed to your perineal genital care purposes. So it is to remove secretions and odors, to decrease bacterial growth and prevent the spread of microorganisms, and lastly to promote healing after vaginal surgery and deliveries. So the nurse must act in a calm and professional manner. Perineal genital care assessments. So you have to assess for the presence of irritation, excoriation, inflammation, and swelling, excessive discharge, odor, pain and discomfort, urinary or fecal incontinence, recent rectal or perineal surgery, and indwelling catheter. You also have to determine perineal genital hygiene practices and self-care abilities. Now let's proceed to the feet. It is essential for ambulation and merit attention when people are confined to bed. Each foot contains 26 bones, 107 ligaments, and 19 muscles, and functions together with standing and walking. So we have here common foot problems. First, we have your calluses, corns, unpleasant odors, plantar warts, fissures between the toes, and fungal infections, such as your athlete's foot or tinea pedis or ingrown toenails. For your calluses, it is a thickened portion of epidermis, a mass of keratotic material. Most calluses are painless and flat and are found on the bottom or side of the foot over a bony prominence. Calluses are usually caused by pressures from shoes. They can be softened by soaking the foot in warm water with Epsom salts and abraded with pumice stones or similar abrasives. Creams with lanolin help to keep the skin soft and prevent the formation of calluses. Next, we have your corn. It is a keratosis caused by friction and pressure from a shoe. It commonly occurs on the fourth or fifth toe, usually a bony prominence such as a joint. Corns are usually conical, circular, and raised. The base is the surface of the corn, and the apex is the deeper tissues, sometimes even attached to a bone. Corns are generally removed surgically. They are prevented from reforming by relieving the pressure on the area, for example, wearing comfortable shoes, and by massaging the tissue to promote circulation. The use of oval corn pads should be avoided because they increase pressure and decrease circulation. Next problem is unpleasant odors. It occurs as a result of perspiration and its interaction with microorganisms. Regular and frequent washing of the feet and wearing clean hosiery help to minimize odor. Foot powders and deodorants also help to prevent this problem. Next, we also have your plantar warts. It appears on the sole of the foot. These warts are caused by papovirus hominis virus. They are moderately contagious. The warts are frequently painful and often make walking difficult. The primary care provider may curettage the warts, freeze them with solid carbon dioxide several times, or apply salicylic acid. Next, we have your fissures or deep grooves. It is frequently occurring between the toes as a result of dryness and cracking of the skin. The treatment of choice is good foot hygiene and application of an antiseptic to prevent infection. Often, a small piece of gauze is inserted between the toes in applying the antiseptic and left in place to assist healing by allowing air to reach the area. Next, we have your athlete's foot or your tinea pedis. It is a ringworm of the foot caused by a fungus. The symptoms are scaling and cracking of the skin, particularly between the toes. Sometimes, small blisters form containing a thin fluid. In severe cases, the lesions may also appear on the other parts of the body, particularly the hands. Treatments usually involve the application of commercial antifungal ointments or powders. Prevention is important. Common preventive measures are keeping the feet well ventilated, drying the feet well after bathing, wearing clean socks or stockings, and not going barefoot in public showers. Lastly, we have your ingrown toenail. The growing inwards of the nail into the soft tissue around it. Most often results from improper nail trimming. Pressure applied to the area causes localized pain. Treatment involves frequent hot antiseptic soaks and surgical removal of the portion of nail embedded in the skin. Preventing recurrence involves appropriate instruction and adherence to proper nail trimming techniques. Now let's proceed to the nails. These are normally present at birth. They continue to grow throughout life and change very little until people are older. At that time, the nails tend to be tougher, more brittle, and in some cases, thicker. The nails of an older person normally grow less quickly than those of a younger person and may be ridged and grooved. Now let's proceed to mouth. Each tooth has three parts: the crown, the root, and the pulp cavity. The crown. It is the exposed part of the tooth which is outside the gum. It is covered with a hard substance called enamel. The ivory-colored internal part of the crown below the enamel is the dentin. We also have the root. It is embedded in the jaw and covered by a bony tissue called cementum. Next, we have your pulp cavity. It is located at the center of the tooth that contains the blood vessels and nerves. Now let's proceed to plaques and tartar. What is a plaque? It is an invisible soft film that adheres to the enamel surface of the teeth. It consists of bacteria, molecules of saliva, and remnants of epithelial cells and leukocytes. On the other hand, your tartar is formed when plaque is unchecked. It is a visible hard deposit of plaque and dead bacteria that forms at the gum lines. Now let's proceed to hair care or your hair. It reflects a person's feeling of self-concept and socio-cultural well-being. Becoming familiar with hair care needs and practices that may be different than our own is an important aspect of providing competent nursing care to all clients. People who feel ill may not groom their hair as before, as a dirty scalp and hair are itchy, uncomfortable, and can have an odor. The hair may also reflect state of health. For example, excessive coarseness and dryness may be associated with endocrine disorders such as hypothyroidism. So we have here common hair problems. We have dandruff, hair loss, ticks, pediculosis, scabies, and hirsutism. Dandruff. It is often accompanied by itching. It appears as a diffuse scaling of the scalp. In severe cases, it involves the auditory canals and the eyebrows. Dandruff can usually be treated effectively with a commercial shampoo. In severe or persistent cases, the client may need the advice of the primary care provider. Hair loss. It is common in men, thought to be a hereditary problem, and normally occurs with aging. Now let's proceed to ticks. It is a small gray-brown parasites that bite into tissue and suck blood, and it transmits several diseases to people, in particular Rocky Mountain spotted fever, Lyme disease, and tularemia. To remove a tick, use a blunt tweezers or gloved fingers and grasp the tick as close to the skin as possible. Gently pull the tick away using perpendicular traction to remove the tick. Be careful to not twist or squeeze the tick's body. If the head breaks off and remains in the skin, use tweezers to remove in a manner similar to that used for removing splinters. Wash the area with antibacterial soap. Save the tick in a bottle of rubbing alcohol in case the primary care provider wants to identify the type of tick. The following practices to remove a tick are ineffective or dangerous: applying heat with a match and applying substances such as petroleum jelly or gasoline. Next, we have your pediculosis or lice. Lice are parasite insects that manifest in mammals. Infestation with lice is called pediculosis. Hundreds of varieties of lice infect humans. These common kinds are Pediculus capitis, the head loose. Next, we have your Pediculus corporis, the body loose, and the Pediculus pubis, the crab loose. For your Pediculus capitis, it is found on the scalp and tend to stay hidden in the hairs. Similarly, Pediculus pubis stays in pubic hair. Pediculus corporis tends to cling to clothing so that when a client undresses, the lice may not be in evidence on the body. These lice suck blood from the person and lay their eggs on the clothing. The nurse can suspect their presence in the clothing if the person habitually scratches. There are scratches on the skin, and there are hemorrhagic spots on the skin where the lice have sucked blood. Now let's proceed to scabies. It is a contagious skin infestation by the itch mite. The characteristic lesion is the burrow produced by the female mite as it penetrates into the upper layer of the skin. Burrows are short, wavy, brown or black thread-like lesions, most commonly observed between the fingers, creases of the wrists and elbows, beneath breast tissue, and in the groin area. The mite cause intense itching that is more pronounced at night because the increased warmth of the skin has a stimulating effect on the parasites. Secondary lesions caused by scratching includes vesicles, papules, pustules, excoriations, and crusts. Treatment involves thorough cleansing of the body with soap and water to remove scales and debris from crusts, and then an application of scabicide lotion. All bed linens and clothing should be washed in very hot or boiling water. Lastly, we have your hirsutism. It is the growth of excessive hair. The acceptance of body hair in axillae and on the legs is largely dictated by culture. In North America, the well-groomed woman, as depicted in magazine, has no hair on her legs or under her axillae. In many European cultures, it is not customary for well-groomed women to remove this hair. Excessive facial hair on women is thought unattractive in most Western and Asian cultures. For example, some Japanese brides follow the custom of shaving their faces the day before the wedding. The cause of excessive body hair is not always known. Older women may have some on their faces, and women in menopause may also experience the growth of facial hair. Excessive body hair may be due to the action of endocrine system. Heredity is also thought to influence the pattern of hair distribution. Now let's proceed to your eyes. It requires no special hygiene. For unconscious client and post-eye surgeries or trauma, special interventions are needed. Now we have here the general eye care. Many clients may need to learn specific information about care of eyes. Some examples follow. First, avoid home remedies for eye problems. Eye irritations or injuries at any age should be treated medically and immediately. If dirt or dust gets into the eyes, clean them copiously with clean, tepid water as an emergency treatment. Take measures to guard against eye strain and to protect vision, such as maintaining adequate lighting for reading and obtaining shatterproof lenses for glasses. Next, schedule regular eye examination, particularly after age 40, to detect problems such as cataracts and glaucoma. So these are your general eye care. Now let's proceed to the ears. It requires minimal hygiene. Clients who have excessive cerumen or earwax and dependent clients who have hearing aids may require assistance from the nurse. Hearing aids are usually removed before surgery. Next, we have the nose. Nurses usually need not provide special attention for the nose. They should be cleaned with a cotton-tipped applicator or moistened with saline or water. Now let's proceed to the back rub. So the purposes of your back rub is to relax. The purposes are to relax and relieve tension, to stimulate circulation of tissues and muscles, and to assess client's skin. We also have here strokes of your back rub. First, we have your Effleurage. Smooth, long, firm strokes, moving hands up and down the back with a sedating effects. So, as can be seen in the picture, this is how your Effleurage stroke is being done. Next, we have your Petrissage. It is a kneading or large, quick pinch of the skin, subcutaneous tissue, and muscle, and it has a stimulating effects. Okay, so as you would see in the picture, this is how you perform Petrissage on your patient's back. Okay, so we have the kneading, we have the large, quick pinch, and the knuckling. Okay, knuckling. Next, we have your tapotement. The little finger sides of each hand is used in a sharp hacking movement of the back, and it also has a stimulating effect. Okay, so we have the hacking and the cupping technique. Okay, so this is your tapotement. So I believe this is the end of my slides.